Welcome to Oncology Data Advisor. Today I'm joined by Dr. Brian Slomovitz, who is live from the ESMO meeting. Dr. Slomovitz, thanks so much for coming on today.
Thanks, Kieran. Thanks for having me. My name is Brian Slomovitz. I'm a gynecologic oncologist in Miami Beach at Mount Sinai Medical Center. In addition, I serve within the GOG Partners Group, which is the group that collaborated with ENGOT to get this trial done.
Awesome. So today we're talking about the results of the innovaTV trial that were just presented at ESMO. For background, how has Tisotumab Vedotin, or TV, been used for the treatment of cervical cancer?
Kira, thanks for that question. So actually, based on the phase 2 open-labeled activity trial with a response rate of 24%, TV, we like to call it Tisotumab Vedotin, has gotten an accelerated approval and is being used in the U.S. but with FDA accelerated approval. This, in fact, was the confirmatory trial to get full FDA approval. The primary objective is a large global randomized phase 3 trial. The primary objective, the primary endpoint, was overall survival. And now, based on these findings, we're hoping not only to have the approval in the U.S., but to have a global impact on this disease, which, as you know, is a very deadly disease. It's one of the most common cancers seen amongst women worldwide, and we need to do better.
Great. So what is the setting that the innovaTV trial is investigating?
Sure. So what we're looking at, the innovaTV trial is looking at women with recurrent or metastatic cervical cancer who failed primary therapy for systemic disease. So they failed platinum-based chemotherapy. If available, they've already also received bevacizumab, which is an anti-angiogenic agent, as well as a checkpoint inhibitor. In those patients that failed, their Tisotumab Vedotin is being studied in the second and third line for recurrent cervical cancer.
So what were the safety and efficacy results of the trial that were just presented at ESMO this weekend?
Yeah, the most exciting was the primary endpoint was reached. That's overall survival. In this population, we saw a 30% risk reduction of death due to this disease based on in those women who were treated with TV. In addition, we saw a significant improvement in progression-free survival. And finally, I think equally as important is that safety profile was similar to what we've seen in the other TV trials. So there were no new signals that we've identified.
That's really exciting. Congratulations on a successful trial.
Thank you.
So how will these results impact the use of TV in the treatment of cervical cancer?
Yeah, so based on these results, I think that from a global perspective, based on a primary outcome, a primary endpoint being reached for overall survival, we should be able to incorporate this treatment into the care of most, if not all, women with this disease. Now, we do know with cervical cancer, sometimes it affects women in low LMICs, low middle income countries. So sometimes it's more difficult to get some treatment, effective treatments to those areas. But in general, globally, we need to do better. There's an unmet need, and these findings support the use of TV in order to help women live longer from this disease globally.
Great. So are there any additional directions or future analyses planned for the trial?
As far as these trials, this is the first endpoint. This is based on interim analyses. Just like any large randomized practice-changing phase 3 trial, this is only the beginning. Even though we're happy with this endpoint, we need to dig deeper, looking at the different biomarkers, looking if there's any of the stratification factors which could account for this benefit. Are there certain things that we can identify which group of women may have a more favorable response or not? So we will look at all those subgroup analyses, those non-pre-specified endpoints. But I just want to hammer home the fact that we got a 30% reduction in risk of death in patients treated with TV versus conventional chemotherapy. Chemotherapy doesn't work in the second or third line setting, as well as some of these new assets, and we've demonstrated again here, TV having an overall survival advantage. So it's more studies will be done, but this is really exciting. One other thing, when you talked about future directions, it's exciting. We are looking at the combination of TV with pembrolizumab and with carboplatin as ways to not only get the advantage of TV, but to sort of get a synergistic effect with other active agents. So there's a lot in the future. Again, this is our first step, but we're hoping to actually have a higher impact for women who suffer from this disease.
Awesome. Look forward to hearing those results as well.
Great. Thank you.
Thank you again for your time today. It was wonderful to hear about these results.
And thanks for having me. I really appreciate you highlighting this trial.